First, a quick review of the superconductive pathway. We know that we have the SA node right up here, and then we have the Bachmann's bundle that extends into the left atrium. Then we have our three internodal pathways. This one is called superior anterior tract, or the fast track. This one is called the posterior inferior tract, or the slow tract. And then we have our middle tract. Right over here we have the AV node, and then the His bundle, which extends from the atria into the ventricles. And this is the only place in a normal heart where an impulse should travel from the atria into the ventricles. Now we have the left bundle, which breaks into the posterior fascicle, the anterior fascicle, and the septal fascicle. And then we have the right bundle, which is a much larger piece of tissue that comes all the way down and terminates into the Purkinje network. So, what happens if the right bundle is blocked? Well, you will have an impulse that travels normally down the internodal pathways into the AV node and through the His bundle. What happens is that it cannot travel down the right bundle because it's blocked, but it will travel normally down the left bundle. And what happens is that it will depolarize the left ventricle normally. But then the impulse has to depend on the cell to cell to cell to cell transmission of the impulse all the way from the left side of the heart to the right side of the heart. And then once it hits the Purkinje network, it will depolarize the right ventricle. So now that we know what happens, how does this look on the EKG paper? The first thing to know is that as we travel from left side of the EKG paper to the right side of the EKG paper to the right side of the EKG paper, we are measuring time. Anytime we are traveling up or down, we are measuring voltage. What happens in the case of a right bundle branch block? As the impulse travels down the left bundle normally, it will depolarize the left ventricle. But then that impulse has to depend on cell to cell to cell transmission to make it to the right side of the heart and depolarize the right ventricle. And once it does, you will get another QRS complex. This is known as a double QRS phenomena, and it's best seen in leads V1 and V2 because of their placement. Now, if we were to come and squeeze these two together, you will end up with what they call an RSR pattern. And if you were to measure from here to here, for this to qualify as a bundle branch block, this measurement of time has to be longer than 0.12 seconds, or 3 small boxes. Another thing to remember is that when we talk about the RSR pattern, is that sometimes you could have an RSR pattern that looks like this. This is not a true S wave, because for this to be a true S wave, it would have to travel down the isoelectric line. However, it is possible to have a right bundle branch block with a true S wave that travels down the isoelectric line. This is still considered an RSR pattern. Some people call this the M pattern. Some people call it bunny ears. But just remember, where you will look for this is in leads V1. Look for this is in leads V1 and V2. However, finding the RSR pattern in leads V1 or V2, knowing that it's longer than 0.12 seconds, are not enough to diagnose a right bundle branch, an EKG with a right bundle branch block. You need to also have the supportive criteria of the lateral leads, which are leads 1, AVL, V5, and V6. And what you will look for in the lateral leads are what we call slurred S waves. And what that means is that you will have a QRS complex with an S wave that is slurred up and then will continue normally. This slurred S wave right here is actually the is actually the right ventricle depolarizing. So you will have a QRS that shows the left ventricle depolarizing, and then you'll have a slurred S wave that shows the right ventricle depolarizing. And then you will have to have this supportive criteria in the lateral leads. And if you were to measure from here to here, it would be longer than 0.12 seconds. So here's an example of an RSR pattern. You'll see this in lead V1 and or V2. And it has to be wider than 3 small boxes. Here's an example of a slurred S wave. In this case, they are showing lead V6, but just remember, you will look for this in all lateral leads, which are 1, AVL, V5, and V6. And so you have your P wave, your Q wave, your R wave, and then look at your S wave. You see how wide it is? We call that a slurred S wave. So this right here, all of this right here is the left ventricle depolarizing, and this right here is the right ventricle depolarizing. And if we were to measure from here to here, it would have to be wider than 3 small boxes. So what are the criteria that need to be met for us to diagnose an EKG with a right bundle branch block? Well, first, in leads V1 and or V2, you have to have a QRS complex that is wider than 0.12 seconds. Second, this QRS complex has to have an RSR pattern or an M pattern. 3, if you were to find your J point and travel backwards, the very first deflection you come to has to be an upward deflection. 4, you have to have the supportive criteria of slurred S waves in the lateral leads, which are leads 1, AVL, V5, and V6. Okay, here's an example of a right bundle branch block. The very first thing I want to do is that I want to go to lead V1. I want to go to my lead V1 and measure my QRS complex. But before I do that, what I like to do is find my J point. So I find my J point and travel backwards. Is the first deflection I come to traveling upward? In this case, it is yes. So then I will measure my QRS complex. Is it wider than 0.12 seconds? The answer is also yes. And then I'll see if I have a RSR pattern. Here's an R, here's an S wave, and here's another R. So I have an RSR pattern. So in this case, I know that in lead V1, I meet the criteria for a right bundle branch block. But I have to have my supportive criteria in my lateral leads. So let's see if I have that. I go to my lead V1. I go to my lead 1. Do I have a slurred S wave in lead 1? I very clearly do. It's right over there. You can see it right over there. Now, let's go to my lead AVL. Do I have slurred S waves in lead AVL? Yes, I do. Right over there. All right. Now what I want to do is I want to go to my leads V5 and V6. If I have slurred S waves in my lead V5 and V6, then I can confidently say that this 12-lead EKG is a right bundle branch block, which I very clearly do. So, yes, now I can say with confidence that what I have here is an EKG with a right bundle branch block.